Hi, my name is Steve Kilburn. I am the Grant Projects Director at the Chautauqua County Department of Mental Hygiene, and I oversee the Chautauqua Substance Abuse Response Partnership, a collaborative work of prevention, treatment, recovery, and harm reduction agencies across Chautauqua County, all coming together to work together to address addiction here in our county. In this series of videos that we've called Let's Heal Together, Conversations to Combat Addiction, we've had many conversations with our partners across the county about the work that they are doing to address addiction. And today I am very happy that we have both Ian Eastman from Evergreen Health and Alison Epsin, a nurse at the county's Department of Health, talking with us about the very important topic of opioid overdoses, and specifically about the use of naloxone, or by trade name, Narcan. Let's turn now to our conversation with Alison and Ian. Well, hi, Alison, and hi, Ian. Thank you guys so much for being a part of this today. Well, we're here to talk about naloxone today, or trade name Narcan. And we're doing so because, as probably anybody who's paid attention to the news recently will know, that in communities across the country, in addition to all the stresses and the struggles of the pandemic, indeed perhaps as a result of them, we have been noting an increase in overdoses. Again, this is a phenomenon that's taking place in communities across the country. We see that in news reports. And as both Alison and Ian would know, these are realities that have not escaped Chautauqua County either, unfortunately. So we're seeing an increase in overdoses in 2020, but we have ways of responding, and that's why we're here to talk today. And maybe I'll ask Alison, what is this naloxone?
So it's the opposite effect of the opiate. As in simple terms. So we're going to reverse what the opiate is doing. That in simple terms.
Yes. No, that's, I think, very helpful. So Ian, we use the phrase opiate, opioid. What are we talking about when we use those terms?
Opioids include heroin, synthetics like fentanyl, and also a lot of prescription pain relievers. So
it's these medications and or street drugs that are under this category of opioids. And Alison, as you said, naloxone in essence is the opposite, or has the opposite effect of an opioid. You want to say any more about that? What does an opioid do, and then what does naloxone?
So the opiate attaches to that mu receptor in the brain and causes diminished pain or euphoria for some people. But it likes that receptor a lot. So when it's stuck there and we now have too much, the brain says, okay, I don't need to breathe. When we give that Narcan, it bumps off, it pushes it off. It acts as a bully to the opiate, and it just gets rid of it for a short term, for 45 minutes, and allows that brain to respond to high carbon dioxide. Does that?
Yeah, that's well said, and thereby allows the body to restore normal breathing, which when we talk about an opioid overdose, that's really the physical phenomenon, isn't it? That the opioid is depressing breathing so much that it can't sustain life. So we have this medication available that will sort of undo the effects of an opioid overdose. How is it administered? In other words, how does a person that's experiencing an overdose actually get it? Ian, maybe you want to respond to that?
Yeah, well, Narcan is a really easy to use medication that reverses the life-threatening effects of an opioid overdose. And here's what a dose of Narcan looks like. If you've ever used nose spray or anything like that, I'm sure you would be able to use this. Some of the places that you can get it from pharmacies. You can get it from the Department of Health, different nonprofits around the community. Here at Evergreen Health, it's available weekdays between 10 and 4. You don't need to make an appointment or anything like that. You can just come in and ask for it. It takes about 10 minutes. In that 10 minutes, we'll explain to you how to recognize the signs of an overdose, how to respond, and we'll provide you with a free Narcan kit. And you can come down and see us at our new location, which is 320 Prather Avenue in Jamestown. If people are watching this video in the north part of the county, I want them to be aware that we have a harm reduction mobile unit that very frequently goes to the Dunkirk area. And they can call or text 716-482-9633. And those folks will let them know like when and where to get a Narcan kit.
Yeah, so this life-saving opioid overdose reversal medication is available and available at no cost. Between Evergreen Health and the county's Department of Health, probably the bulk of the naloxone is distributed, although, as you said, Ian, not only your two organizations, but the two of you have been really on the front lines, in the forefront of getting naloxone out into the community. So it's available through Evergreen. And Alison, you also are involved in getting naloxone to folks. How does that work for you?
So I do the community trainings, where Ian tends to do a little bit more individual. I tend to do the bulk. I do community trainings to anyone and everyone that asks for one. And then whoever comes to participate, we don't ask names, we don't ask where they're from. They participate and they get a kit.
So you do, as you said, community education. How would somebody, maybe a group that's interested in getting that training, how would they go about making that happen?
They can either access the county's webpage, and then that message gets to me, either through email, or they can call me directly, 753-6724. That's a number that they can call or text, and we set up a training at the convenience of whoever wants it.
Yeah.
So.
Well, that's really terrific. Well, let me ask you this. Given that whether in individual terms or even as a group, there are ways, relatively easy ways, to get one's hands on some naloxone, who should have it?
It's important that people know that overdose is actually the #1 cause of accidental death in the United States.
More so than motor vehicle accidents, I think people might be surprised to learn.
Yeah, it has surpassed that. And that we know that most of those overdoses are going to occur in the home. So when a person is deprived of oxygen, every second counts, and getting trained in Narcan and having a kit on hand enables friends and family members to begin that important response immediately.
So, a fairly candid comment would be, if you know someone, or if you are that someone who is using opioids, it would be very important for you to have naloxone on hand.
Yeah, absolutely.
Mm-hmm. Are there others that ought to consider getting a kit and getting the training for it?
I think anybody that either is at risk of an opiate overdose or knows someone that is at risk, it's really important that they get trained in that.
Mm-hmm. So having a kit is, as you described and actually showed us, a small nasal spray of medication that people could carry around with them, certainly have in their home, but also can take in their purse or bag.
Yeah, absolutely. I carry mine around in my messenger bag because I know I'm going to always have that with me.
Right. Alison, I wonder, when you do your trainings, what are some of the things that you make sure that you tell folks about using naloxone?
I talk about exactly how the overdose happens, how to recognize the overdose, what we're looking for when we see that.
And what would that, let's pause for a moment and say that, or talk about that. What does an overdose look like?
So typically just before the overdose is the nod, that chin to the chest, kind of what we call the sweet spot for anybody that's actually using. But if you've nudged them a little bit and they've grumbled, that's a watchful waiting, a harm reduction message, as we say. We don't leave them alone, because they can slip off to that overdose. So now they're in that nod, you've nudged them a little bit, you didn't get a response. They might have a lot of snoring, breathing, it's gurgly sounding. Cold clammy skin, blue lips, blue nail beds, looks identical to a low blood sugar. When we're looking at that, it's not our job to figure out what's going on.
Right.
You're gonna nudge, you're gonna do a sternal rub, you're gonna grind your knuckles in their breastbone. If you don't get a response from that, that's likely overdose, and you're gonna give Narcan, and you're gonna get 911 coming.
So it's important to know that the Narcan or the naloxone should be used with somebody who's actually unresponsive, not somebody, as you said, who may be groggy, nodding, but still awake. But once somebody has become unresponsive, that would be the time to use the naloxone. It's a nasal spray, as you described, Ian, but what if it's not an overdose? I mean, it could be something else. Is there going to be a potential harm by administering naloxone if, in fact, it might not be an overdose?
No. So if it's not an overdose, we do no harm. It would be a rare occurrence that someone has an allergic reaction to Narcan. You wouldn't want to make that risk, in my opinion. You're going to give that. If it does nothing, maybe it's not overdose, or maybe it's fentanyl and you need multiple doses.
Yes, right. So important to know that the administration of naloxone is not, frankly, a very risky act. It has really no other effects other than, as you described, sort of bullying off the opioid molecule off the receptor in the brain. What else, Alison, should a person know if they're trained in the use of naloxone? So they've recognized a likely overdose. They've administered with a nasal spray the naloxone. What else do they need to know?
If they are unresponsive and not breathing, they're going to have to do some rescue breathing. So we train that as well. We teach simple steps of how to do rescue breathing while you're waiting for hopefully to get that response from that Narcan. But to wait that 3 minutes. So what's happening, and what I'm hearing it over and over again now, is that people are your adrenaline's going, so you give that first dose of Narcan, and you're not giving the body time to respond, and they give another dose right on top of it, and then you have typically a different response. I mean, sometimes they're just quite ill when you give it that quickly. So wait that 3 minutes, do that rescue breathing. So we teach that as well, as to how to give, and that's in the kit that we provide, and to give that second dose after that 3 minutes.
Okay, very
we also teach them
important to note that not all opioids are the same. I mean, they have similar effects, but we're seeing more and more, as you described, Ian, these synthetic opioids that are of a potency that really are so much greater even than heroin. And as a result, as you've said, Alison, might require more than one dose of naloxone to treat. What else does a person need to know? Let's say I'm on the scene, I come upon or know somebody in my presence who seems to have had an overdose. I administer the naloxone, I'm monitoring them, rescue breathing if needed, second dose after 3 minutes if needed. Anything else? We need to,
when they do come around, they're not going to be very happy. They're going to be pretty sick. First thing they're going to do is use, and that's the last thing we can let them do. We have to stay with them for that 35, 45 minutes. Let them know you're going to feel better in a half an hour, 40 minutes when that Narcan wears off. We didn't get rid of the opiate. It's going to come back on that receptor, but hopefully at that lower threshold. And certainly, I think harm reduction is that we don't leave them alone. If we have to leave them alone for any reason, we're going to get them on their left side, turn them on their side, left arm underneath their head, left leg bent, so they don't come back on their back or go belly down, because they're going to vomit, aspirate and die from.
So I think, when we understand sort of how naloxone works, kind of kicking off, bullying off the opioid so that the respiratory depression stops. We also come to realize that, as you've described, Alison, that this is not necessarily a permanent arrangement. In fact, the period of time that naloxone works can be shorter than the amount of time that the opioid stays in the system. And so the naloxone, in a sense, could wear off, and the person still has blood levels of opioids that could return them to an overdosed state.
Yes.
Yeah.
Especially with fentanyl.
Yeah. Do I call 911?
Oh, well, yes. Sometimes in the past, people have been afraid to call 911 because they're afraid of arrest. It's important to know that New York State has a really good Samaritan law, and that protects people. So if there is a drug or alcohol overdose occurring, that's going to be responded to as a medical emergency. They don't have to fear arrest. And that's also, I think, really important with students going back to school and things, that they understand that if they're witnessing something, that they can call 911 and do the right thing, and New York State's going to back them. Really, it's a law that has saved a lot of lives.
Yes. So for the reasons that we've been talking about, while the immediate emergency might be addressed with the use of naloxone, it would be very important that this person receive medical care. This is a very serious event and ought not to be dismissed too quickly. So we do encourage people to call 911 and to be familiar with the Good Samaritan law.
Just to add on to that, most of these folks aren't using heroin alone. They're using it with benzos, they're using it with alcohol, further depressing the respiratory system. In Jamestown, we've got a lot of people using it with methamphetamine. We don't know what else is going on with that person, that you want the best chance of them being evaluated and a chance for treatment option.
Yes.
If they go on. Is today the day that they'll take a treatment? I don't know, but
it might be, and I want to talk about that here in a moment, because we're obviously speaking about immediate life-saving efforts, but there are implications here for longer-term treatment, improvement, quality of life, etc. Just before we turn to that, though, I want to ask, opioids aren't the only overdoses that can and do occur. As you said, Alison, cocaine, methamphetamine, alcohol, Narcan, useful in those cases?
No. Narcan only will work on the opiate.
Right.
But there are other strategies that people can take to reduce some of the negative effects of that use and hopefully avoid some of those things. So for folks that maybe are using something other than an opiate, using methamphetamine or coke or something like that, we can provide education for them that could help them avoid some medical emergencies.
Yes. And I think, we are hearing, and you guys probably especially so, given your interactions with folks, that, well, it seems like probably a rule of thumb should be that virtually any street drug is potentially laced with fentanyl at this point. So while a person may not even be intending to take an opioid, they, in their methamphetamine, their cocaine, heroin, may well be ingesting it without even realizing it. Is that fair?
Yes.
Yeah, and that's why it's important, for folks to get trained in Narcan. Sometimes people, associate Narcan strictly with heroin use, but I think it would be important for anybody to be trained in this and in the use.
Yes. Well, we've been talking about how naloxone works. I want to ask the question, does it work? Now, of course, we know it does. Studies, etc., have made that patently clear. But I mean, in your own observations, is this something that is really making a difference in Chautauqua County? What would you say to that, Ian?
Well, right behind me is a whiteboard, and each time somebody comes in and lets us know that they've reversed an overdose, we change the whiteboard and kind of celebrate that with a person. And right now, that's at 590 reversals in just about 5 years of our program.
590 instances of naloxone, not just being distributed, not just 590 trainings, 590 uses of it to reverse an overdose.
Yeah. Narcan is a very easy to use drug that can reverse the effects of an opioid overdose in as little as 2 to 3 minutes. And that 2 to 3 minutes can make all the difference in the world.
Absolutely. As you know, as we tragically know, in those instances where it's not been available. Yeah. Alison, does it work? What's your experience?
My intelligence comes from the people in use. So when I'm talking to people on the rehab units, or when I'm talking to people that are incarcerated and listen to their stories about being Narcan many, many times, it saved a life.
Yes.
And that's what matters.
Absolutely. And again, you know, as far as sort of an available option to save lives, it's hard to think of something that's more immediately available and more immediately effective than naloxone. And that the numbers that you describe are really staggering. So when a person really has had their life saved by naloxone, is that sort of the end, or does this sort of harm reduction initiative maybe pose the opportunity for more success down the road? What's, Ian, your experience with that?
Well, I think every person's journey is different. And Narcan is something that you're using at maybe the point of crisis. And we know that it's very effective at saving a life. We do know folks that have gone on further in their recovery journey and are doing well. And one gentleman actually gave me permission to share that he was actually Narcaned 8 times. And he is doing well in recovery, and he realizes that had it not been for Narcan, that he would have never had that opportunity to make those changes in his life.
Absolutely. Yeah, I mean, even that one instance is a powerful story. As you said, it isn't always that first time or the second time, but being, just out of compassion alone for the immediate emergency, it should be used, obviously, but to also give somebody another chance to take steps forward in their life.
Yeah, everybody's journey is different, and I know certainly at Evergreen Health and many other providers, there are a lot of services available to help people wherever they want to go at this point in their life. Right. So there are many different avenues. Everybody's recovery looks different, and there are many people that will help them get to where they want to be.
Yes.
Everybody's going to be treated respectfully at Evergreen Health. We value their lives. We value where they're at in their journeys. And it's really important for us to listen to them and understand what they need right now, and what help we can provide them at that point. That can be everything from maybe managing their use a little bit better, understanding overdose and preventing overdose, to getting linked up with recovery services or other healthcare services.
Exactly.
Everybody's different, and we're going to honor that.
And I've heard you say, Ian, that the opportunity that connecting with somebody just where they're at is one of the great values of it, is the connection itself.
Yeah, absolutely. I mean, we all want to be heard, and we've all had the experience of a healthcare provider not hearing us, I bet. And so more so when a person is using substances, they're very frequently stigmatized and maybe not treated as well because of their addiction. And that doesn't help them, and it doesn't really help anybody.
No.
And so let's start with respect for people and where they're at. And I think that it's really a bigger benefit to them and it sets the stage where some great changes can occur.
Absolutely. Thank you. Well, both of you mentioned earlier, but I just want to underscore again how folks can get naloxone. They can come to Evergreen Health, and we'll leave the contact number there. They can walk in, no appointment needed, during your business hours and get trained and get a free kit. They can call the county's Department of Health at the number, Alison, that you've given, which we'll also leave in the notes, and can set up a training for a group. By the way, does it have to be a big group?
Nope, any size.
Any size group. You will go and make arrangements with them and go to them and and provide them. And these are probably the two most common ways perhaps that people get naloxone, but there are other ways as well. It's available through pharmacies. Anybody that's on an opioid prescribed should probably also have a prescription for naloxone and have that on hand. Overdoses don't necessarily happen only in recreational drug use. There can be other reasons why somebody can take an overdose, and if there is that medication in the home, there should also be the reversal medication. There is in New York State the NCAP, the Naloxone Co-Payment Assistance Program. So if a person has health insurance, they can access naloxone at a pharmacy and shouldn't have to pay any copay. So that's another way in which they can receive it. This is a hugely important topic, and perhaps more so than ever right now. Are there any other points that we didn't cover that either of you would like to make before we wrap up today?
Well, I think it's important that anybody, if they feel like they need Narcan, can get it in New York State without any barriers.
Yes.
The New York State Department of Health has signed a non-patient specific order, so you don't need a prescription to get Narcan. Even if you go to a pharmacy, if you request it in New York State, there are providers that are going to find a way to get that to you.
Yes, it's very accessible. Well, I want to thank both of you, Alison and Ian, certainly for taking time to share your understanding, your experience, and your expertise about naloxone, such an important topic right now. But I even more want to thank both of you for the hard work that you guys do. Again, you're saving lives, and lots of them. So on behalf of really the whole community, I just want to say thank you to both of you for the work that you guys do. Well, another big thanks to Alison and to Ian for participating in today's video and for the very important work that they are doing, life-saving work here in our county, work that is affecting, as we've heard, hundreds of people directly, but when you consider the family members and the friends of those folks as well, what an impact they are having here in Chautauqua County. I want to say that the Chautauqua Substance Abuse Response Partnership, this collaborative work of agencies across the county, is helping to facilitate a countywide strategy to get naloxone into as many hands as possible, so that we can reduce the number of overdose fatalities. We will leave in the notes accompanying this video contact information for Alison Epsin at the county's Department of Health and for Evergreen Healthcare. We'll also leave further information about the Good Samaritan Law. And again, encourage folks to be familiar with that and not to hesitate to call 911 in the face of a medical emergency. Well, thanks to all of you for viewing this, our latest installment of Let's Heal Together, Conversations to Combat Addiction. Stay well, everyone.